July is Novacure Brain Tumor Awareness Month, raising awareness about the most aggressive type of brain cancer, glioblastoma or GBM, from innovative technology and treatment options available to the importance of self-advocacy. In fact, I'm saying it right. GBM Awareness Day is July 19th. Today I have Dr. Remus Lucas, Associate Professor of Neurology at Northwestern Medicine, and Jason Tharp, a patient living with GBM. Good morning to both of you.
Good morning.
First of all, what is GBM and how prevalent is this type of brain cancer among Americans?
GBM stands for glioblastoma multiforme, which is the old name for something now called glioblastoma IDH wild type. It's a type of primary brain tumor, meaning a tumor that starts in the brain, and it falls into a camp of tumors called infiltrating gliomas. So they're interwoven with normal, healthy brain tissue. About 15,000 individuals are diagnosed every year in the United States with this tumor.
Doctor, what are some of the common symptoms?
The way I conceptualize the symptomatology is either localizable or non-localizable symptoms. So localizable means it's due to the specific location in the brain. So in one place, it can cause weakness. Somewhere else, it can cause language problems or personality changes. If it's irritating the outer portion of the brain, it may induce seizures. And then the non-localizable symptoms are due to increased intracranial pressure. And these manifest as headaches that are worse when you're lying down, or may wake you up from sleep and be associated with double vision, nausea, vomiting.
What are the latest treatments and therapies available to treat GBM?
The way that we treat GBM currently is with a maximum safe surgical resection, so trying to remove as much tumor as possible. This gives us diagnostic information, and nowadays we're pretty aggressive about trying to interrogate that tumor at not just the cellular level, but at the molecular level to get a good understanding of what's driving it and the way we can potentially treat it. This is then followed with radiation therapy delivered in a fractionated manner, so broken up into days, where you get a small dose every day to a big cumulative dose with some concurrent oral chemotherapy, a pill called temozolomide. And then in addition, this is followed with cycles of that same temozolomide chemotherapy at a higher dose with the addition of tumor treating fields, which are alternating electrical fields that are delivered by a set of arrays applied directly to the scalp.
Doctor, what are some of the side effects of this treatment?
So when we're thinking about the side effects of the chemotherapy, we worry about drops in blood counts, we worry about constipation, nausea, vomiting, etc. In general, we can control those pretty well. With the tumor treating fields, what we see predominantly is skin irritation because you're applying these arrays directly to the scalp.
Now, Jason, can you share your personal story about being diagnosed with GBM and how your treatment plan has impacted your life?
Absolutely. For me, it started with a seizure that led me to the ER because I've never had a seizure before, where I had a CT scan, then an MRI where they discovered where the tumor was. A neurosurgeon was confident that he could remove majority of it. Later to find out after surgery that they was to remove all of it. Just as Dr. Lucas explained, I went through chemo, radiation, and then you're still kind of left in this little dark window trying to figure out, the stuff. And rather than turning to Google to search what this was, because all you really do find is bad stuff, I decided to take a different approach. I started searching GBM good news, and that led me to novacure.com, where it was discovery of the TT fields, the device that I currently wear now. And it was just somebody on there sharing a clip that said that they still ski. And to me, that just meant hope. And so, along with that, I started to think about what role I play in the situation. The doctors around me, do I have the best co-captains around, understanding that I can control what is happening right now instead of trying to write a future that is unpredictable or live in a past of something that's already happened. How can I control the things I can control at this moment? So I started to address, things like my health, my mental fitness, my, the way that I'm approaching every day. Am I being the best thing? And if I'm going to be somebody that's going to break this thing that others may call impossible, how do I act as if I am that person? And can I do that each day? And so checking in with myself and making sure that all those things, and this diagnosis has allowed me to embrace that even more in my daily life.
Now, Jason, why is having a positive outlook so important when facing adversity?
It's everything. I think that, what a lot of people fail to understand is that sometimes people will provide information to you based on their limited experience of what they've been told. But the thing is that they're not experts on the most important part of your life, which is you. You're the expert on those things. So if you don't like the answers that you're getting, ask better questions. Don't be afraid to stick up for yourself. You're the one living this life. Nobody else can live it for you. And if you can be brave enough and not shrink into it and be courageous enough to step into that version that you're seeking or you're looking for, I think that what most people would find is, in all the fears that they're seeing, lies that version and love and all the stuff that you're looking for in yourself that has been there all along. You just maybe weren't looking in the right direction. And for me, that's what being an advocate for this type of stuff has opened up the door for, not only through myself, but now helping other people feel the same way.
Jason, you sound like Iron Man. You sound like Iron. Now, Jason, how would you encourage? Okay, take it, man. Take it. Wear it. Jason, how would you encourage others to be their own advocate, especially when it comes to one's health?
Absolutely. So the big thing that I tell a lot of people is that, I love all of my doctors, and they have provided me with such great information. Now, it wasn't always that way. I had to let some doctors go that were initially on the team because they couldn't understand, or based off of what they were presented or what they knew, and the questions that they asked. So when I decided to ask better questions of myself, it allowed me to kind of look at, like, who was taking part of this whole thing, who's helping me, do we share the shared vision, and then being brave enough to, like, say, like, I don't like the answer you're giving me, I need to find somebody else. And that's okay. And understanding that, the everybody around you are really good experts at all the information, but the only thing that you're not providing is information of yourself, and that's what you're an expert on. So putting that to the forefront, you actually help everybody else around you get better because you're not afraid to share what's going on in here, so that way they can take their information and add to the mix.
Now, Dr. Lucas, what should people know if they are a loved one, are diagnosed with GBM?
So I think one of the things that I want to highlight are that there's constantly evolving knowledge. So we're collectively aggressively looking into how to beat this tumor. And so what we know now is different than what we knew 6 months ago, and hopefully it'll be different 6 months from now in the future. So there should be hope, and there should be a strong focus on moving that field forward. I think I would advocate, as an academic neuro-oncologist, in a biased manner, I would advocate for meeting with somebody who treats these tumors all day long, and then figure out what the best plan is. Even if that plan is initiated closer to home, there may be value in seeking that input. And then probably lastly, I would say, you can look to legitimate sources of publicly available information. So examples of that are going to be organizations like the American Brain Tumor Association, or ABTA, which provides info to patients and families, as well as helps fund important research that's going to change the field. And then if you're interested in things like the tumor treating field, you can go to novacure.com as another source.
Today I've been talking with Dr. Remus Lucas, Associate Professor of Neurology at Northwestern Medicine, and Jason Iron Man Tharp, living with GBM. I'm going to call you Iron Man, Jason. It's fitting good, for you. Okay.
I'll take it. I'll take it.
All right. Gentlemen, thank you for joining us on Morning Blend.
Thank you so much.
Thanks.